Okay, so today is our second episode in our Ask the Experts series, where we speak to a whole bunch of different professionals to help you to sort of digest scientific information and information from different disciplines, to see how it applies to you, to help to motivate you, and sort of to clear up any mysteries and things like that, and all of the rubbish that can circulate around social media. So we're hoping to connect with you a little bit more in that way. Today, we are speaking with the brilliant Dr Jilly Boden. She's a paediatric registrar currently working at the Queen Alexandra Hospital in Portsmouth. Now, for those of you with an eagle eye, you might notice the similarities between myself and Jilly. We are in fact sisters. But today, Jilly has kindly given up her time to talk with me about her experience, not only as a doctor during the COVID pandemic, but also as a patient who was admitted to hospital herself after contracting the COVID-19 virus. So I'd like to start with your own experience with catching the infection, if that's okay, Jilly. At this time, this came reasonably early on in the pandemic. You're a young woman, no pre-existing conditions, and yet you found yourself, as I said, admitted to hospital with the infection. Can you share with us how it affected you? How did you know that you needed to take a test? I assume as a doctor you're taking regular tests anyway, and then how the virus proceeded for you.
So, first off, thanks for doing this. It's great to be able to give sort of some accurate information when there's so much false information going around. So initially during the first wave, which is when I caught COVID-19, we weren't having regular testing at that point. And an important thing to note is that I only actually got tested because my son had a temperature. And we weren't even really testing the children at that point, even if they had symptoms. It was just, we were just told to isolate. But because I was working in the neonatal intensive care unit, the hospital managers just felt, oh, we better test her just in case. So it was really at that time when it was very hard to get a test at all. And my son's test came back negative, as did my daughter's test, my husband. Mine got a little bit lost in translation, and eventually 3 days later I got the result back that I was positive. What's really important to note is that I felt completely fine. I was absolutely fine. I was continuing to work. So it's really important to think about this possibility of asymptomatic spread and making sure that if you come into contact with someone, you are isolating, because I had no idea at all. I felt completely fine until, ironically, the afternoon after I found out I was positive, I started to feel really quite unwell. And as you can imagine, at first I was telling myself in my head, you're being ridiculous, you've been fine, you only feel like this because you now know that you've got COVID. But quite rapidly, actually, over the course of just that afternoon, considering that I tested positive 3 days earlier, I started to get very short of breath. Now, we'll go on to this a bit later, I'm sure, but I am not very fit. I don't do hardly any exercise. I try, but it usually stays in the try phase rather than the moving on to the actually doing it phase. I would probably get breathless if I went for a brisk walk. Now, I was getting breathless getting up from the sofa to go to the kitchen. I was having to suddenly start pausing halfway up one flight of stairs in my own home, which I've never had to do before. Getting to the top and really having to wait and catch my breath back, just like I'd run for the bus or something. And it was getting to the point where I had to plan what I was about to say so that I could do it with enough breath. Wow. So instead of just having a conversation like this, I'd have to think, what am I going to say, and go, and then breathe again. And that's when I started to think, maybe it's not all in my head, who knows. So I called my GP, who was brilliant on the phone. We can absolutely access the GP still. They are still open, they are still seeing people, they're just triaging them. They advised that as I'm normally fit and healthy, and it was just the breathlessness, then I could probably stay at home and make sure that I didn't get any worse, but if it got worse, to call them again. And my husband became a bit more concerned about me and felt it was getting worse, so I did call back, just exactly as the GP had perfectly safety netted, and he noticed on the phone that I was unable to really chat to him. And he thought, that's probably when you need to go in. So I went into hospital for an assessment, and it was found that my oxygen levels, when I'm breathing normal room air like we all do every day, were very, very low. So a normal oxygen levels, generally speaking, are over 95% when somebody's just breathing in room air. Mine were hovering around 70%,
Wow.
which is really quite a drop. It's not like 70% is your B grade at school. 70% is really quite low. Yeah. They were fine when I was sat still, but the moment I moved even about 10 meters, they just plummeted. And so my oxygen carrying capacity, so my abilities to be able to use oxygen that's available to me in normal room air, was really, really poor. And it meant that I couldn't sort of process the oxygen available to me to move, or speak or do anything really. So yeah, it was a bit scary.
Yeah, I bet it was. Yeah.
Yeah. I had a few occasions where I did cough up some blood as well. I think that's why they also wanted me to be seen. It's a rarer side effect of COVID. I think it only happens in about 5% of known cases. So it's a recognised but rarer side effect. So that obviously didn't help the fact that there was a bit of blood in my lungs as well, taking up the space where the air should be.
Yeah.
Thankfully, I did really well, thanks to all the fantastic nurses and doctors and bits and pieces. I engaged in multiple trials while I was in there. Because of the early days, we weren't entirely sure how to treat it and how to progress. And I think I stayed in for about 3 nights in total, just receiving some oxygen and rest, really. There was nothing much I could do without oxygen. But the fantastic care I received, and then obviously getting home and having support from my friends and family, I was one of the lucky ones.
Wow. So do you feel that there were any factors, considering your age and your sort of lack of any other conditions, that we are often hearing is, oh, that's the only reason that you'll get ill is because you've got underlying conditions or you're over 80 sort of thing. Do you feel that there were any factors that led you to getting such a severe reaction to the infection?
Yes, there's quite some clear risk factors. And it was a stark reminder and a bit of a wake-up call, to be honest, because I am white Caucasian, so that's not a risk factor. Certain ethnicities have higher risk factors. I don't really have any complex medical backgrounds or take any regular medication. I'm a non-smoker. I don't have diabetes, but I am overweight. And I have been for a long while actually. My BMI when I was admitted to hospital was 34, which is, really not acceptably, it's quite high. And because I don't have any other risk factors, it became really quite apparent to me that actually that was really probably the reason that I didn't do so well. And probably the reason that it was a hospital admission rather than flu symptoms at home. So that was quite a wake-up call, and it really does show that you don't have to be a very elderly, very sick person to suffer from COVID worse. It can be just the modifiable risk factors that we all have and we're all in control of.
So that really was sort of my next question as well. Is there anything you're going to try and incorporate going forward to try and improve your health, not only for things like COVID, because hopefully this is not something that's going to be repeated too frequently in the near future, but the healthier you are, the better you are off against many conditions such as diabetes and heart disease and things like that. Is there anything that this is really stimulated to change for you going forward?
Yes, it really has. It's a very difficult cycle to get trapped in, actually.
Yeah.
Eating unhealthily and not having time for exercise. And often we are, and I'm certainly guilty of this, too tired or don't have the time. But it's that realization that if you ate better, and it's not necessarily about the amount you eat, but the nutrition in that food. So I could eat the same amount of calories, if calories is what you like to focus on, in chocolate or in fruit and veg and bits and pieces, and I would get far more vitamins and minerals and energy from the fruit and veg and fibre and bits and pieces than I would in the chocolate. So that's important to know. So the type of food you're eating, when in the day you're eating as well, trying to force yourself to eat lots of things when you're not hungry because you feel it's the best thing to do because somebody said it once, maybe something to consider. Maybe listen to your body and eat when you are hungry. Mm-hmm. Trying not to get to the point where, or this is certainly what I practice, trying not to get to the point where you're absolutely starving Marvin. So you go, oh, I haven't eaten anything all day, so now I'm going to have that big takeaway because I deserve it. Mm-hmm. So you can eat not very often, but eat badly. And I think that's a trap that I fell into. Mm-hmm. Being too busy at work to eat properly. So just having bits out of the snack drawer instead of making time for lunch. And again, that reflects back onto concentrating and having something meaningful when you do eat rather than snacking on mindless things. Yeah. And then obviously the exercise as well. So I didn't have a lot of respiratory reserve. So the backup pack that we should have, so when you do have to run for the bus, it's not awful. You can do that little jog, you can run up the flight of stairs, or maybe 2 or 3 if the lift
speed of recovery from that as well.
Absolutely. And then getting over that, so having that backup in reserve so that if you need to use it, you can. That's what I didn't have, and that's why I feel I suffered worse with COVID. So incorporating exercise into every day, sometimes not specifically a set exercise routine for an hour and a half Monday to Friday, 2 hours on a Saturday, Sunday, but acknowledging that there's little bits and pieces and changes you can make each day, and turning your exercise into a hobby so that your you time that you get to do when you relax is actually something that's beneficial for you. So rather than I sit and watch TV to relax every night, actually I might do a bit of yoga or something.
Absolutely. Yeah, I mean, touching on a couple of the points that you've just made there, sort of first of all, talking about calorie-dense foods versus nutrient-dense foods. As you've said, it's not necessarily about feeling like you're forcing yourself to be hungry, but if you do eat those higher nutrient-dense foods, they tend to be higher in water, higher in fibre as well, both of which, higher in protein too. All 3 of those factors will make the food more filling and therefore sort of help you to moderate your calories naturally. But also sort of saying the exercise for your headspace as well is such a huge thing, particularly at the moment. And you can tell that even the government, who tend to be about 10 steps behind on what we really need as a nation, fitness and health-wise, it's at the moment, unfortunately, it's very much reactive, and we look to medicine for our health rather than proactive looking to fitness for our health. You can tell that the government are at least acknowledging that, because throughout the entire thing, they've always had that you can go out and exercise, you can, go and do something. So even in the very height of the first lockdown with the most strictest measures, there was always that, do go out and exercise each day. So I think that's a really valid point. So thank you so much for sharing that element with us, because it's a very personal story for you, and also to talk about your weight and fitness and things like that. So I really appreciate that, because I think that will identify a lot with our audience too. So to that end, you've also kindly agreed to talk a little bit more about your perspective as a doctor as well. So things like type 2 diabetes have been particularly associated with a range of not only health risks in general for many years, but also COVID's made it abundantly clear that elements like type 2 diabetes, which is typically a lifestyle related disease, and it can even be cured by excess fat loss and fitness improvements. COVID's almost like a big old slap in the face to say, this really does put your health at risk, and it puts your health at risk right now. So why do you feel that the COVID risks are so much higher? Or can you explain to us, why are the COVID risks so much higher for people who are diabetic, and also for people who carry excess body fat?
Well, it's really sort of, there's sort of 3 prongs to it. And I guess the questions you're answering me is, why do people with diabetes or excess weight get COVID worse, and why is their management more difficult? Because it is much more difficult. And I'll put that down, it's very complex, but to try and make it a little bit more digestible, I thought I'd break it down into sort of 3 subjects.
Okay.
One would be the metabolism. Okay, and you don't have to be a scientist to understand metabolism, we can go into that. The second would be what I call inside fat. or visceral fat, and then the third would be outside fat, so what you can see, your size 10 or your size 16, your jelly belly, outside fat. Okay, so first off, metabolism is everything that your body does, everything that it does to maintain your normal status. So to give you energy so that you can physically move and breathe and process and think, to keep your temperature at the right time, to keep your digestive system going, to keep your heart going, everything. So metabolism is really important, and it's how your body breaks down what you put in to give those energy to focus on all those different outputs. Okay. Now, there's something called metabolic syndrome, which is something that I would recommend that most people just have a quick Google search on, because it's not really widely talked about or recognized, but it's really, really important. And it feeds into sort of type 2 diabetes. A lot of people who carry excessive weight, myself included, don't have type 2 diabetes. So they kind of think they've got a bit of a free pass because they're okay. Yeah, I'm chubby, but I'm healthy. I don't have diabetes. Well, actually, you're going to have a degree of metabolic syndrome, which is maybe slightly high blood pressure, but not enough to put any medicines on, and slightly high sugars, but you're not actually diabetic. And all of those things together really put a strain on your metabolism, and they make it much less effective. That makes you much more tired. It makes all your processing slower, and it makes your body less effective. And having any aspect of metabolic syndrome makes your body a less effective machine, less able to cope with ongoing onslaughts, less able to cope with managing diseases and infections. It uses up all your reserve. It makes you tired. And it really, really can have a knock-on effect for the whole of your life and the whole of your health.
It's a real like vicious cycle then, because that's going to make people less inclined to exercise and things.
And you don't have to be formally type 2 diabetic to actually have a degree of sugar processing disorders and insulin resistance. And it's those type of people that feel that because they don't have a diagnosed condition that they are healthy. And actually we're not. We could do a lot more to be a lot more healthy. So metabolism and having a good metabolism is really important for all aspects of fighting off disease and living a healthy life. So moving on to inside fat. This is the fat is called visceral fat, and it's the ones that sort of line your organs and sneaks around and sits in all different weird, wonderful places inside your body that you wouldn't know about. It hugs your heart, it hugs your liver, it sits around your intestines. It can actually leach into your bones and make them more fragile. Yeah. It makes your muscles ache. It makes your joints stiff. Okay. And so you don't actually have to be a size 18 or size 20 to have a higher degree of visceral fat. And that again links in with metabolic disorder. You don't lay down visceral fat unless you're struggling with how to process calories, intake and fat. Okay. Your body puts it in a more sensible place if you are overall healthier. Okay. In and around your organs and your joints is not sensible. Okay. So it's that internal fat that makes it very hard for your body to process bits and pieces. It gets in the way, it slows everything down, and it's that's the more sort of what classically we think is the more dangerous fat with regards to health and cholesterol, stroke and heart attack risk factors, developing diabetes. It sort of interferes with all of our organs. It can physically push as well and lay down in places that you don't really want it to. So technically there can be some in the air spaces in the lungs.
Oh, wow.
Yeah, so it gets rid of that reserve that I was banging on about earlier. Yeah, if it's all in and around your abdominal organs, it can squash those organs so they don't move and are free to their full potential. So your heart might not beat just as well as somebody else's. It's all very what we call subclinical, but it adds up. Okay. And then lastly, the outside fat, the one that we all look in the mirror and we can see, and that's the thing that most of us want to get rid of because that's what we're reminded of daily when we look in the mirror. That in itself isn't as dangerous, I would say, as the visceral fat, but it is from a helping you point of view, and it is from a management point of view if and when you do get into hospital. So firstly, if you can calculate however overweight you feel you are, say you feel you're 2 stone overweight, imagine going for the walk that you can go for with a 2-stone fat suit on. That would be really hard. So how much easier would it be if you weren't wearing that 2-stone fat suit? Try and imagine it like that. It's an excess one. Yes, you can cope with it now, but how much better would you be without it? And the same goes with other people trying to physically manage you. So the larger people who are on ventilators at the moment, which is something where a tube goes down into your airway and the machine breathes for you because you're that poorly, getting that tube in to a really chunky neck is really hard. Okay, because there's pressure and fat on the back of your neck. There's also a layer of fat over your chest that increases pressure on your lungs. So the pressure of the machine has to go up to combat the extra weight that's sat on your chest. And that's not insignificant. Okay, getting lines and venous access on people who are very large is very hard because our veins hide under our little layer of chub that we've got. And it's very tricky to do that. And every time you introduce a new needle or a new line or something, you're introducing possible infection. So the physical management of people who have that extra layer on them is really quite hard. Something else that they're doing that really seems to help with COVID and relaxing the respiratory or the breathing system is called proning. So those that are on these ventilators, to help them breathe and help them recover, every now and then we try, or at least daily, we try and turn them so that they're on their front. Okay.
Yeah, I've seen lots of images of that on the news as well.
Yes, proning. It's really important, and it's shown to really help with COVID. Now, I need you to imagine that we've got an overweight, larger person, okay, who has a bit of a tummy on them. Their arms are a bit chubby. Their airway's a bit unstable because it's quite hard to access. Turning that person over when they are unconscious, so a sleeping, completely non-compliable weight, is very hard without risking whipping that airway out, without risking taking those lines and cannulas out. And physically turning them, it takes at least 4 or 5 people to turn somebody who is not overweight over. And then they're laying on their stomach, which spreads out, pushes up into the diaphragm, stops the diaphragm from moving easily. You turn the pressures up on the ventilator even more. That can cause trauma to the fragile bits that actually are your lungs. So it's a whole host of things that actually make you as a machine harder to look after.
Wow, that's really, and also the sort of the clips from the news as well. Obviously, as a whole nation, we've got this constant message of let's try and protect the NHS, and the NHS is, yes, it's facility, but a huge amount of it is personnel and knowledge. It's the people who are running it and the people who are delivering the care. And the pressure on them, the amount of people that are in the wards, the amount of wards that are operating, the shortness of the staff, turning patients all the time. It's a very physically demanding job as well as mentally demanding because of all the deaths that they're witnessing and things as well. So it's really interesting that you've been able to kind of lay it out for us in that way. So you did touch on it a little bit earlier with your own experience, but on the flip side of the reason that being overweight makes it harder, why does being fitter provide you with better protection from, or likely to lessen the infection if you do catch it?
So it goes back to the reserve that you've got, essentially. It means that your heart and lungs, so your cardiovascular system, has got that capacity to deal with additional stress without it tipping you over the edge into illness. My reserve is very, very poor and small, and I'm doing things to address that now. But it meant that when I did have that additional strain, I just couldn't cope with it. So it's like, essentially, when you get very mentally stressed and you start snapping at people and you don't have a lot of reserve going on there, and then all of a sudden you have a bit of a breakdown and everything's awful and you cry over something really simple. It's the same with your physical body. You need to have that backup and that reserve and that resilience that you can do, so you can every now and then stretch yourself, but be fine with that. And that stretch could be your own personal challenge, like going for a run, or that stretch might be something unknown that's going to get you, like COVID or the flu or anything else. Even if you were to have a heart attack or something, if you're physically fit to begin with, you can cope with that insult a lot better, and you'll come out with it a lot better. And then also it's about having the space and room in your body for everything to do the job it's intended to do, to not be squished by something, and to not be dampened down by higher levels of insulin and higher levels of floating around sugar, regardless of your diabetic state. Processing toxins such as alcohol, or any other drugs, or prescribed or cheeky, naughty, blunt drugs, they're all going to have an interruption on that metabolism, which is what I was harping on about earlier, which is the most important thing to keep our bodies running.
Yeah, absolutely. I think whenever I discuss metabolism with our clients, or with clients even just in a consultation, I always keep referring back to the metabolism essentially being like your engine.
Absolutely.
The engine in your car. And if you've got like a super muscle car metabolism, it not only burns up fuel really quickly, so it enables you to enjoy larger portions, or enjoy your meals and things a little bit more without gaining weight, but also it makes you feel invigorated. That muscle car can pull away from the junctions really easy, and it can accelerate, and it can tackle hills and things like that. Whereas your sort of energy efficient car, if you've got a metabolism that's running very, very low, it's very hard to keep the weight off because you're not burning much off, but you're also less inclined to exercise because you feel sluggish. You've got that duvet of excess fat on you and things like that. So although it's a vicious cycle, just trying to remember that the positive cycle goes in the same way as well, in the complete opposite direction. So it's that bravery and confidence and something to motivate you, like I say, the COVID slap in the face, to trigger you to start changing the direction of that cycle. Boris Johnson said himself, after his own experience with COVID, he feels that had he been fitter and lighter, that he would have dealt with it better. He wouldn't have ended up in intensive care. So hopefully, once the big intensity of the pandemic starts to subside, we'll start to see more support for people getting more engaged with exercise, and we can, as a nation, start to move towards, like I say, prevention rather than medication. And we can save the medication and that knowledge and things that you and the NHS as a whole has for the stuff that really needs it. So hopefully, there are some silver linings to this, that people might hopefully begin to value their bodies and their health a bit more. And I'd just like to sort of wrap up my own contribution to this with my favorite quote, which is one from a guy called Jim Rohn, which says, look after your body. It's the only place you have to live. So it's like, you wouldn't burn your house down, and yet we just abuse our body. So, look after your body, because, you want to live a happy and exciting life. So do you have anything else that you want to add before we close up for this interview?
Not really, no. Thank you for giving me the opportunity to have a chat through what's gone on and try and dispel some mistruths and bits and pieces, and remind everybody that you don't have to be formally diagnosed with anything to be carrying risk factors. Just got away with it doesn't mean you will continue to. So that's my thoughts and feelings, and that's how I'm going to try and carry on. I think that's really useful information, and I certainly learned a lot from what you were saying as well, that I'll be able to hopefully continue to help our clients with as well. Thank you so much for your time, Dr Boden. And it's interesting calling you Dr Boden, Jill. We will very much, personal trainer Megan.
Sorry?
So thank you very much, personal trainer Megan.
Personal trainer Megan. Yes. Okay, you're right. You take care, and we'll catch up with you again soon. Thank you so much.
Right. Thanks then. Bye.